In this video, I'm going to discuss how osteopathic manual practitioners from the CCO treat headaches. Headaches can come from many different problems in the body. They can come from things like malnutrition, things like oxygen problems, things like malalignment of the vertebrae in the neck. They can come from problems with the lungs. They can come from problems with arteries being compressed in small areas in the body, in the head. They can come from things like too much caffeine, or not enough exercise, or not stretching enough, or trigger points. These things are all possible causes of headaches. An osteopathic manual practitioner from the CCO will look at your entire body to determine whether your headaches are coming from your neck, or from your head, or from your chest, or from your middle back, or possibly from even as low as your low back or your feet. There's been some cases where even foot bones and problems with alignment in the feet can actually cause enough pull to cause someone to have a headache at the end of the day, especially if they've got some sort of problem with a collapsed arch or that sort of thing. So we'll look at the entire body. When we look at the body, what we're looking for again is to try and determine whether there's proper movement, and if that proper movement can be restored through the hands of the osteopathic manual practitioner with small adjustments. Okay, now a patient will come into the clinic, they'll do a full history. When they finish the history, they'll go through some observational and assessment tests, and when the osteopath has determined what part of their body is stuck, they'll provide the correct treatment. This treatment might take the form of cranial manipulation, in which an osteopathic manual practitioner will put their hands on the side of the head of the cranium and listen for the proper movement, and then apply a technique to that part of the cranium to get those bones moving properly, to decrease the pressure inside the head and hopefully help with the headache. They will assess the bones of the neck for proper movement, and if required, they will create or use a technique that will allow the movement of those bones to be restored. They'll check the breathing mechanism of the patient, the top part of the lungs, and they'll stretch the tissue in the neck if needed to help to allow for good breathing movements. And they'll check the lower back itself, especially the sacrum and the sacrum's relationship with the two hip bones called the iliums, in order to allow that movement to occur, to allow the proper movement of the sacrum when a patient walks, and therefore decrease the pull in the cranium. If you suffer from headaches and would like one of our students to have a look at you in our student clinic in Toronto, please look at our website at www.osteopathy-canada.com or collegesofosteopathy.com. Click on Student Clinic and click on Book an Appointment.